20% of all genes in our body are redox genes. So I have seen that, and we have mapped it out. So how ASEA turns on each one of these genes, I mean, in my clinical practice with my lab, that's what my work has been for past year, to map out the biological pathways. So it turns on mitochondrial TCA activation, ATP production, DNA repair, stem cell activation, lipid metabolism, protein and amino acid biosynthesis, nucleotide management, repair of DNA. So it does all kind of things, right? And that's beautiful because then at a clinical level, we're able to see before and after labs of heavy metals, pesticides, herbicides, environmental toxins, chemicals, mycotoxins, oxidative stress, and at a genetic level, we're able to see reversal of biological age. And it's beautiful to see somebody who is 69 comes in at 71 years of age, and 3 months later, they're at 65. The biological age just reverses by 6 years and 3 months, not only from ASEA, because I'm doing other things, but it amplifies it. And ASEA adds that fuel, the catalyst, it adds all the resources that are inherent to all these biological pathways to have them become more efficient. So they can amplify anywhere from 30 to 600%. And the speed at which things happen is beautiful because as a provider, I want to have a win for my patient within a week or within 2 weeks. And when somebody goes to 20 other places, including Mayo and Cleveland Clinic and Johns Hopkins, and then they come to see you, and within a week, 50% of their issues kind of decrease by 50%, that's huge. That is the speed. And so, and we're seeing it at a clinical lab value. Like, I'm not just saying it because it's my anecdotal evidence or my visual perception of how people are. We're actually calculating, okay, this person decreased aluminum from 197 to 20 in 6 months. Right? Super high to zero, almost. And that compared to other patients who I've been taking care of for the past 5-6 years, we haven't seen that. So we've seen decrease, but it's like, okay, it takes 2 years to get you down. This one took 6 months. So then now I'm speeding up the process. And it's just beginning. I mean, I'm doing some more stuff, but maybe next convention I'll talk about those things. But these things are, if you're interested in your testimonials, I would encourage every single one of you here to have your environmental toxins, mycotoxins, heavy metals, pesticides, oxidative stress tested, and then 6 months later do it again, and then you will have undeniable testimony to share to get pretty much anybody enrolled or, anybody try, to anti-age and become healthy, and then enrollment will just happen. So that becomes extremely easy because you have your own personal testimony. You're not claiming anything. Here's a lab. ASEA didn't claim anything, right? I don't have to say anything. Just put a PowerPoint presentation with 3 slides and it's a done deal. and Frank saw that. We had that at the Disrupt conference, one of the conferences I went to. We had a huge banner of this size with labs right on it, and if anybody passes right next to the picture and the poster, they see it, and that's it. I'm not speaking anything. Here's the data. You want this for your patient? Then here's what you gotta do, and that becomes a little bit easy. So I think all of you guys can do it. Have meetings and those kind of things. So that's the clinical side, and that's the genetic side because we're mapping everything out. There is no product on this entire, at least that I have, practice with. All the supplement companies and all the other products, pick one product that affects 20% of all genes within 20 minutes, right? I can't find one. I've been working with another PhD scientist to map some of these things out as well. And his hypothesis was that this was going to be a snake oil, and he was going to tell me not to do this. But after working for 3 months, he came back and said, Doc, I know you want authenticity and credibility in your words. I'm going to tell you that in my 30 years of experience, this was the #1 product. Like, I haven't seen anything like that.